Hi, I'm Dr. Shim Ching, board certified plastic surgeon here in Honolulu, Hawaii. Today, we're going to be talking about part 2 of what you need to know before a tummy tuck. In part 1, we went over who's a good candidate, how surgery is performed, and what kind of results you can expect. In this video, I want to go a little deeper into what happens before and after surgery, what recovery really looks like, what you can expect day by day, and some of the most common questions I get from my patients. One of the biggest questions I get before tummy tuck is how long is recovery? For most patients, I tell them to expect 2 to 3 weeks of downtime. That's the period when you really want to rest, stay home, and let your body heal. A lot of my patients are moms who've had children, and recovery feels similar in intensity to a C-section, although it's a little bit different. The discomfort, the tightness, the limited mobility, it's a comparable level of recovery. The first 2 to 3 weeks, I recommend avoiding travel, heavy lifting, or exercise. Don't plan on doing errands, driving long distances, or doing anything strenuous. This is your time to let your body recover properly. After that, we'll guide you through a gradual return to activity. Light walking first, then slowly introducing more movement and exercise over time. We provide a detailed recovery protocol that outlines exactly what's safe at each stage. That's something I always emphasize. It's important to review these instructions carefully with your surgeon because every tummy tuck is a little bit different. During a tummy tuck, we repair the abdominal muscles. Those are the muscles that often separate after pregnancy, a condition called diastasis recti. Because of that repair, it's very important to avoid any activity that engages your core too soon. If you tighten those muscles before they're fully healed, you can cause separation again and add unnecessary tension to the incision. So we focus on keeping your abdomen supported, usually with a compression garment, avoiding bending, twisting, or lifting anything heavy for several weeks. Pain is something people understandably worry about, but in my experience, it's very manageable. We use several methods to keep you comfortable after surgery. During surgery, I inject a long-acting local anesthetic and mix it with a small amount of steroid to extend its duration. This numbs the entire abdominal area, blocks certain nerves so that when you wake up from surgery, you actually feel very little pain. The local anesthetic usually lasts anywhere from 12 to 20 hours. After that, as the medication wears off, patients typically start to feel soreness and tightness build over the first 2 or 3 days. That's when pain is at its peak. We prescribe pain medication that can include mild narcotics, anti-inflammatories, and muscle relaxers if needed. Everybody's pain tolerance is a bit different, but almost all patients get through this without any issues. By the end of the first week, most patients are surprised by how much better they feel. I always tell my patients, don't rush your recovery. Your body just went through a major operation. Resting is part of the healing process. Trying to do too much too soon can lead to swelling, fluid buildup, delayed healing. Take those 2 to 3 weeks as an opportunity to really slow down. Have support at home. Somebody to help you with your meals, kids, or driving if needed. If you had a C-section before, you'll find that this recovery feels similar in the way you move, stand up, and walk for those first few days. After surgery, we'll have you wear a compression garment. This helps reduce swelling, supports your abdomen, and improves comfort as your body adjusts. You'll wear it for most of the time for the first few weeks, and gradually less as healing progresses. It's not the most comfortable thing in the world, but it does make a big difference in your recovery. Patients will have small drains placed to remove fluid after surgery. We'll show you exactly how to take care of them. Most drains will come out in the first week or 2. You'll notice swelling during that time, and that's completely normal. Swelling can last several weeks and even a few months in some cases as your body continues to heal. A tummy tuck does involve a long incision, usually from hip to hip, but it's placed very low, just above the pubic area, so it's hidden by most underwear and swimwear. In the first few weeks, the incision will look pink or red, but over several months, it will gradually fade. We recommend silicone-based scar treatments and some protection to help the scar mature well. Every patient heals differently, but with proper care, most scars will become quite discreet. You'll see an immediate change in contour right after surgery, but your final result will take time. The first few weeks, you'll be swollen and tight. By about 3 months, you'll really start to see your new shape. And at 6 months to a year, most patients say they feel completely back to normal, often even stronger and more confident than before. Now let's talk about some common concerns I hear in consultations. One question I get a lot is, what if I gain weight after my tummy tuck? Small fluctuations are going to be normal, but significant weight change can stretch the skin again. Best thing you can do is to keep your weight stable. Another question I get is, can I get pregnant after tummy tuck? Yes, you can, but generally I don't recommend doing this. I really recommend doing a tummy tuck after you're done having kids. A future pregnancy will stretch out the abdominal skin and muscles again, which can undo the result. Some patients ask, will I lose weight from the surgery? A tummy tuck isn't a weight loss procedure, it's a contouring procedure. You might lose a few pounds when the tissue is removed and liposuction is done, but the real change is in the shape and tightness of your abdomen. And finally, what about liposuction? In many cases, I combine liposuction with a tummy tuck to improve the waistline and the flanks and improve the result. It really depends on your anatomy and your goals. So if you're thinking about this procedure, preparation is key. We'll review your medical history, make sure it's at a stable weight and that you're in good health. You want to stop smoking and avoid certain medications that increase your bleeding risk before surgery. I always tell patients, a tummy tuck is a partnership between you and your surgeon. The best outcomes will happen when you follow your pre and post-op instructions carefully. A tummy tuck can be life-changing. It's one of the most satisfying procedures I perform because it restores confidence, posture, and comfort, especially for mothers who've gone through pregnancy. The key is understanding what to expect. Take time to heal, follow your recovery plan, and stay patient with your results. Your body is transforming and healing at the same time. If you found this helpful, I encourage you to watch part 1 if you haven't already, where we go over the basics of the procedure and what makes somebody a good candidate. I'm Dr. Shim Ching, board-certified plastic surgeon here in Honolulu, Hawaii. Thanks for watching, and we will see you in the next video.